Excellencies, distinguished guests, dear colleagues and friends, thank you for joining us today for the presentation of the first progress report for the Global Action Plan for Healthy Lives and Well-being for All. The Global Action Plan is a collaboration between 12 multilateral health, humanitarian, and development agencies that have committed to working together to support countries to accelerate progress towards the health-related targets in the Sustainable Development Goals. The Global Action Plan works to support national plans and priorities through 7 accelerator themes and our commitment to gender equality. The heart of our mission is to deliver a tangible impact where it matters most, in countries. The progress report outlines how together we have moved from the 4 key commitments of the Global Action Plan to engage, accelerate, align, and account to action, and we are now laying the groundwork for sustainable impact. 5 case studies demonstrate how the plan is grounded in joint support for countries and how it has increased trust, social capital, and working relationships among the agencies. The report outlines how together we will continue to help countries protect the health gains they have achieved, recover from the COVID-19 pandemic with more resilient and sustainable health systems based on primary health care, and continue in our efforts to achieve the health-related SDGs. In the face of the many challenges that countries face from the COVID-19 pandemic, our shared mission of coherent, coordinated support from the multilateral system is more important than ever. Strong, sustained leadership and the support of member states and partners are critical to achieving this ambitious goal. I now give the floor to Peter Singer, who leads the GAP Secretariat, to present the findings from the report. But before I move to Peter, I would like to thank the Pathfinder countries who have brought the idea first. That's Germany, Ghana, and Norway for their leadership. Thank you so much. Peter, you have the floor.
Thank you very much, Dr. Tedros. I will, in the next few minutes, present some of the key messages of the report, which was launched today. And these are as follows. This is the first progress report that talks about the progress of the Global Action Plan since its launch in September 2019. It does show how the agencies have moved collaboratively from the commitment that they made and the plan to action. It shows that countries are at the heart of the Global Action Plan. It shows that a lot of the work has happened through the accelerators and our commitment to gender equality. It shows that the working relationships among the agencies have improved. It also is quite honest about some of the challenges that have been faced, as this is a mid to long-term really mechanism for improvement. And some of those challenges, as outlined in the report, include the need to double down on the institutionalization of collaboration in all the agencies, right down to the country level. The need to really hear the encouragement of countries, of partners like those of you watching, for the agencies to keep collaborating and to strengthen collaboration. And then finally, the need to work even more closely with civil society partners. And that's a commitment that we will pursue over the coming year. In terms of going down one granular level of detail, the agencies are working, as Dr. Tedros said, with 5 countries that are detailed in the report, but also many others through the primarily primary healthcare and sustainable finance accelerators so far. The accelerators of primary healthcare and sustainable financing that I've mentioned, but also communities and civil society, determinants of health, fragile settings, data and digital, innovation, and gender equality as an overarching commitment are up and running. We're working to align our processes, to institutionalize them in agencies, and we're working to account for our progress. And this progress report is a beginning of that accounting process. We've looked at how we evaluate gap in an evaluability assessment, laying the groundwork to a 2023 independent evaluation. And we started to transfer some of the lessons to other SDGs as well, Sustainable Development Goals, such as the acceleration framework for water and sanitation. In closing, I just want to reiterate the 4 watchwords of GAP that were also in Dr. Tedros' remarks: challenging, essential, leadership, and results. Collaboration, of course, is challenging, but it's essential, because if we've learned one lesson through COVID, it's how important the multilateral system is, particularly for the most vulnerable in the world, and how important it is that we strengthen our collaboration. Leadership is required to do that, and although collaboration is a process, the real issue here is results. It's getting back on track towards the SDGs, accelerating progress towards the SDGs, and thinking about that individual at the country level and that family who is helped by the support that multilateral agencies working together can offer to countries. I'd like to thank all the agencies, their heads, and all their staff, and all our partners, and everyone who's encouraged us along the way.